Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you a whole bunch of exercises you can do using the foam pad or the airex pad as part of your exercises and routine after knee replacement surgery. These are just kind of quick hits of a ton of different exercises you can do. The foam pad is obviously an uneven surface, helps to challenge your balance, your coordination, your stability a lot more than, say, being on just a regular even surface floor. Be sure to hit that subscribe button and turn on the notifications if you don't subscribe already so you can catch all of our latest videos related to knee replacement surgery. So I like to start with the foam pad right in front of you. If you're on a hard surface, it might be a little slick or slippery, so it might be beneficial to put something down just to help keep it from sliding around on you if that's an issue. So usually with most patients and most clients, I'll start and I'll say just step up on the pad with both feet. And feet side by side, about shoulder width apart. And we're just going to start by shifting our weight side to side. We don't have to pick up our feet, but we're just trying to get our body weight all the way onto one leg and then shifting it all the way onto the other leg. Getting comfortable, balancing, and being stable on the foam pad. And of course, I don't have shoes on right now, but you can do this with or without shoes as you feel comfortable. If you do feel a little unsteady, good to do this standing by the kitchen counter or a tabletop so you can kind of catch yourself if you start to lose your balance, or having someone there to guard you and to assist you can work as well. So after you do side to side, we're going to shift our body weight forward and backward. So forward onto the balls of your feet and then shifting back onto your heels. Again, not trying to lift your feet up into the air necessarily, but just shifting your weight forward and backward. And do that for maybe about a minute, minute and a half. From there, I like to either with feet staying in this position or coming into what we call a Romberg stance with your feet together touching, so a narrower base of support. And we can try just holding that for 30 seconds. If that's pretty easy, we can add trying to close your eyes now, and now trying to hold that for 30 seconds. And I always like to do a couple repetitions for all of these, just because the more you practice, the more you work on the balance, the more you'll see the improvements from doing so. So just trying with feet together, trying to close your eyes and hold for 30 seconds or so. The next one I like to do is I'll actually turn the pad on a diagonal and have one foot in the back corner, and then we'll have a tandem stance or a heel to toe stance with the other foot in front. Now trying to hold this position, again an even narrower base of support, and trying to hold your balance, maybe do 30 seconds or so, and then switch the position of your feet so you're doing it on both sides. With all these, you can add on, again, eyes closed again, which is pretty challenging. You can do eyes closed. You can add some movements with your torso or your upper extremities, your arms, which I'll show you here now. So again, you can go back to a regular stance or feet together. You can always make any of these movements more challenging by narrowing your base of support, so feet together or tandem stance, or if you're really good, even going on to single leg stance as well. And then what we can also do is adding in some movements of your torso. So just rotating to one side and rotating to the other. And doing maybe 10 or 15 each direction. You can go really slow, or you can go at kind of a medium speed like this. Sometimes I'll also incorporate some reaching, so as you turn, you can reach with your arm, like so. Also, we can stand in place and we can just focus on our head and neck. So doing turns side to side with our head, or looking up and down with our head. We can do reaching again, so we did the diagonals. We can also do reaching forward, one hand, then the other. Or maybe you're reaching out for some cones or something on the wall. And I always encourage people to really try to shift your weight and lean forward like you're reaching for something in the kitchen or in the bathroom. You know, some people will stand up and they'll just bring their arms up and down like this. We really want to do that reach and practice shifting your weight forward and backward in a controlled manner. We can do out to the side as well. Reach out to one side, reach out to the other side, back and forth. We can also use the airex pad for just doing step-ups. So we can do forward step-ups, we can do taps, we can do step up all the way and then back down. We can step up and over, and even come back if you're pretty good and coordinated. We can do side steps, tapping up and down, or coming up and then back down, or even coming up and then coming over to the other side. So lots of options, of course. You're just trying to be creative with everything you're doing. Sometimes I'll have people one foot on the pad, one foot off, just holding that position, maybe bringing your feet close together. Or we can do, we can keep our foot on the pad, and we can just do steps, forward taps. We can do lateral taps with our foot balancing on the pad, diagonal backward, diagonal forward, straight backward. So a lot of creative, functional things that you can do with the Balance airex pad. I'm sure there's some other creative ideas out there. I'd love to hear them if you have any of them. But really it's about being creative, working on, normal base of support, narrow base of support, eyes open, eyes closed, shifting your weight, rotating, moving your body, adding that perturbation, those movements. You can do pass and catch with the ball, all sorts of different things. So I'd love to hear in the comments if you have any other exercises that you love and enjoy to do using the foam pad, the airex pad, either if you're someone before or after knee replacement surgery, or if you're just someone who's working on your balance and stability. As always, I ask that you please again hit that subscribe button if you don't already, so you can catch all of our latest videos. Be sure to leave your comments and questions below as I do my best to get back to everyone I see. And as always, please be sure to hit that like button to help spread this video out to other viewers. Thank you very much for watching.